It can be tricky to diagnose a child with obsessive-compulsive disorder, OCD, says Jeffrey D. Kent, MD, a child and adolescent psychiatrist in private practice in Jericho, NY, who serves on the voluntary staff of North Shore Long Island Jewish Medical Center. Often, it will first show up as irritability, anger, or school problems. Dr. Kent explains. Lots of kids hide their true symptoms because they don't know that there is anything anyone can do about them. Although children and teenagers with OCD may be embarrassed about having this anxiety disorder and not want to confide it to many friends, it's actually a relatively common problem. 1% to 2% of young people are affected. OCD in children, the anxiety disorder. Those symptoms can be, understandably, very troubling. When a child has OCD, according to the American Academy of Child and Adolescent Psychiatry, AACAP, and the International OCD Foundation, he may have obsessive, uncontrollable thoughts about almost anything, such as burglars entering his house, being exposed to dangerous germs, or a specific sexual or violent image. In an attempt to diminish the anxiety caused by the obsessive thoughts, children with OCD often compulsively repeat behaviors. These may relate to the content of the obsessions, like excessive hand-washing or repeatedly checking window and door locks, for instance. Or the behaviors could be unrelated, as in the case of a child who vomits after dinner to rid herself of the anxiety caused by obsessive thoughts about harming family members. OCD in children, the cause. Although a single definitive cause of OCD hasn't yet been determined, there's clearly a link to problems with pathways and chemicals, especially serotonin, in the brain. For that reason, medications, such as the antidepressants selective serotonin reuptake inhibitors, SSRIs, are often effective. In recent years, evidence has linked the onset of OCD in some children with strep infections, says Kent. Research suggests that an antibody against the Streptococcus bacteria, part of the body's natural immune function to fight infection, acts on a brain enzyme and triggers an acute disorder in children that mimics the effects of OCD. This disorder, known as PANDAS, short for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococci, is treatable with antibiotics. To prevent this form of OCD, says Kent, be very vigilant. For instance, if some family members have strep and are being treated and one child doesn't seem to have strep, check to make sure that child is not a carrier. If he is, make sure he is treated right away. OCD in children, the treatment. According to the International OCD Foundation, 4 drugs, all SSRIs, have been specifically approved for treating OCD in children: clomipramine, anafranil, fluoxetine, Prozac, fluvoxamine, Luvox, and sertraline, Zoloft. In addition, 3 other drugs, paroxetine, Paxil, citalopram, Lexapro, are sometimes prescribed. None of these drugs modifies OCD symptoms overnight, or even in a week. It can take from several weeks up to 3 months to see significant improvement. If the first medication does not seem to be effective, the dose can be modified or the other medications can be tried, one at a time, until the right match for the child is found. Such experimentation is best done by a psychiatrist who specializes in treating children, even if it means you must travel a considerable distance for consultations, says Kent. Although you should bring your initial concerns about OCD to your child's primary health provider, he encourages parents to see a psychiatrist next. Otherwise, it usually falls to a pediatrician to treat OCD, and that's sometimes successful and sometimes not, he explains. OCD in children, psychotherapy options. An additional possible treatment for OCD in children is psychotherapy, especially cognitive or behavioral therapy, according to the AACAP. It's also important for parents, siblings, and other close family members to become educated about OCD and to provide emotional support to the child who has it. A good starting point is the International OCD Foundation's website.